Good evening. This is Stan Matthews in the Matthews broadcast, streaming worldwide at www.gemsradio.net on Gems Radio and TV. For those of you who don't know, you can also tune in locally at 91.7 FM. Welcome to the Empowerment Enrichment broadcast, and for the next hour or so, we're going to be discussing issues in the area of health and also in the area of nonprofit foundations and what they can do to improve the lives of those people in our community here in this country and indeed abroad as well. We are going to be joined by two very special guests, and so we're going to get going in a moment. But before we get into the subject of the night, I always want to make sure that we ask you to support our super sponsors without whom we could not have a broadcast. So these are the companies that support us and ensure that there will be a Matthews broadcast. So I want you to contact them. I want you to support them. I want you to patronize them, so that we can circulate dollars in our own communities. First and foremost, I want you to support the Urban Business Association. The Urban Business Association is an organization which was founded to circulate dollars in urban communities throughout the state of New Jersey. It was founded by Jerry Moultrie and Keith Broadway, and Jerry and Keith had a vision of an organization that would circulate dollars in our own communities. I don't know if you know, but last year in the United States of America, urban communities had the spending power of $4.1 trillion. That is out of a $19 trillion U.S. economy. And right here in the state of New Jersey, there's $432 billion. That's the gross state product of goods and services in the state of New Jersey. Urban communities account for $137 billion of those dollars. So these communities are very, very wealthy. Black and brown hands nationally and in the state of New Jersey are very wealthy, and so Urban Business Association was founded to see that those dollars benefit those communities, because unfortunately those dollars do not always circulate in those communities that have that spending power. Secondly, I want you to support Dokita 247. Dokita 247 is an app that you'll be hearing more about. You can go to Dokita, D-O-K-I-T-A, 247.com. It is an app created by Dr. Richards Afanja, an internist out of Paterson, New Jersey. And that application is going to allow people to see their doctors, have their prescriptions filled by telemedicine. Telemedicine is now a phenomenon that is with us. There are several companies who are seeing patients via their smartphones. And Dr. Rafanja's vision is that telemedicine will be available in remote parts of this country, remote parts of the continent of Africa, and remote parts of the Caribbean, where there may not be, in South America, where there may not be a doctor quickly at hand. But if you have a smartphone, you can speak to your physician. You can get your prescription filled, and you could also be directed to either a mobile clinic or a clinic very close to where you are. So look for Dokita, D-O-K-I-T-A, which is a Nigerian term for doctor, Dokita247.com. That application will be launching very soon. For mobile marketing and advertising guaranteed to take your sales higher, call Trey and Daniel at Billboards for Hire. Billboards for Hire employs a very advanced team of trucks with 20-foot digital billboards on the side of the trucks that can get out your message visually as well as high-powered audio. So if you want to take your marketing and advertising even higher, call Trey and Daniel at Billboards for Hire. You can reach them at 917-756-0043. Divorce is a matter that must be done right. if it's done at all. We'd like you to call our master counselor, Sonia like that, and friend Cassandra Savoy. Cassandra can be reached at 973-748-0097. She's very local here in Bloomfield, New Jersey, has been in practice for a long time, and is just a superstar in the area of mediation and getting a divorce done right. Again, Cassandra's number is 973-748-0097. Nothing says I love you like flowers. You've tried the rest. Now we invite you to try the best. A Rose's Petals. Carolyn and Nathaniel Joe, they are the florist that you should call. They're at 973-742-5333. 973-742-5333. They're at 472 Bloomfield Avenue. 472 Broadway in Paterson, New Jersey. Mr. G's Restaurant, where good friends meet, greet, and of course eat. Mr. G, Russell Grady, as he's lovingly known, is the Dean of African American entrepreneurs in the state of New Jersey, having been in business for 54 years. His restaurant is at 455 East 18th Street in Paterson, New Jersey. You can reach them at 973-782-4020. For real estate advice and planning, acquisitions, or sales, that's always great. Call Smith Gilmore Real Estate. Violet Smith Gilmore and her team are located at 1258 Teaneck Road in Teaneck, and you can reach Smith Gilmore Real Estate at 201-723-4203. 201-723-4203. So if you're buying, if you're selling, if you're an investor and you need your real estate managed, they even go to court on your behalf. So for advice, planning, and service, that's always great. Call Smith Gilmore Real Estate. Funding Magnet. Funding your plans so that you can live your dreams. For companies that want to raise capital, $5,000 to $25,000 in less than 90 days without any debt, call Funding Magnet. Mr. Anthony Hibbert is the owner of Funding Magnet. He can be reached at 973-357-3698, 973-357-3698. The mortgage you need for the home you want is at Citizens Mortgage. They've been in business for more than 30 years. Marichelle Alvarez and her dad are at 111 Common Avenue in Fair Lawn, New Jersey, and you can reach Citizens Mortgage at 201-398-0800. 201-398-0800. So we have covered what we needed to cover, and we are happy about that because I don't want to put my guests to sleep in here. I want them to be nice and fresh, and so we welcome Dr. Winston Scott, and we welcome our friend Sonia Scott, who's been with us before. He is an ophthalmologist with a practice in East Orange, New Jersey, and she is an all-rounder, as we say in the Caribbean. The question isn't what Sonia Scott does, the question is what she doesn't do, and Winston is there to support all of it. But she's best known as the owner-operator of Dorson Home Care and also the Dorson Foundation. And so we want to welcome them to the Matthews broadcast. And I will turn it over to Lisa here to ask them a few very easy questions so that we can have some discussion and you, our audience, can learn how to do business with Dr. Scott and also with Mrs. Scott in the foundation as well. Lisa?
So how are y'all doing today?
Oh, very fine. Thanks for having us.
Very good. Want to say welcome back, and welcome. This is your first time, yes?
Yes.
All right, glad to have you too. So our first question is, what is the name of your business or organization?
Well, my business is Winston J. Scott, MD.
Mm-hmm.
I'm an ophthalmologist, eye physician, and surgeon, and I've been practicing in East Orange since 1983.
Wow.
And in the same community in East Orange, and I think we've been developing a good comprehensive eye care to our patients. not just medical, but surgical, and also good advice and everything my patients ask. I'm able to, and I try my best to provide information beyond ophthalmology.
Okay, very good. Then that means I think you may have actually answered my second question,
Mhm.
but I'll ask it anyway. What is the unique value of your business?
Well, again, I'm a doctor who, when I graduated from my residency program, had an opportunity to go anywhere in the country to practice.
Mm-hmm.
But I liked East Orange. I went to Cornell University. I had friends who said, come to California. I had friends in California, in Florida who said, come that way. I liked East Orange. I fell in love with my patients during the clinic while I was training, and I decided I wanted to stay right there. I've been there since 1983. And again, we provide comprehensive care in all aspects of eye care. Right now, I do mostly cataract surgery, glaucoma care, take care of a lot of diabetics. As you know, diabetes has been an epidemic proportions in our country, worldwide actually. But we have a lot in East Orange, and I enjoy bringing my unique way of talking to my patients, and have no intentions of leaving anywhere. So I enjoy doing that, and I think I give them a little extra that they may not get elsewhere. I can communicate with them a little bit better, and that's what they tell me.
Very good.
Those are good things to be told.
Well, I understand what it is to be in love with the people of East Orange, Irvington, Newark. I've been working in the area for a lot of years, so I totally get that. I totally feel you there. So what is a great referral for your company?
Well, my patients. Patients who are happy, word of mouth. At first, we used to advertise a lot. We used to do anything we can to market. But I find the best marketing is to take good care of my own patients. Word of mouth is the best way of bringing them back. Yes, things have changed. You do have to be on social media. You do have to be on the internet. So we do that as well. But by far, word of mouth, a happy patient who's very, very satisfied with the care we give them. That's been my biggest way of bringing patients back to me.
Oh, okay. Yeah. All right. So what are you offering our audience, our listening audience this evening in return? Any discounts, anything special?
Yes. We don't have a specific price on anything, but anyone would come in and identify themselves that they heard of my practice on tonight's program, Gem Radio, we will definitely give them a discount. So when they come in, they speak to our office manager, Andrea Ricketts. Andrea will know to expect them, and she will talk to them about some type of discount. We not only have the comprehensive eye care with examinations, we also have an optical shop. We dispense glasses, contact lenses. So again, let us know, and we make sure that it's discounted to them.
Now, I just want to sneak something in here. Now, if there's any name that's common to all of the English-speaking Caribbean, isn't it Ricketts?
Yes.
There's Ricketts everywhere. Bermuda, Belize.
That's right.
That's the universal Caribbean name.
Ricketts, and even my first name, Winston. That's a very British Caribbean name. Everyone born right after World War, any boy born right after World War II, where Winston Churchill was considered such a hero in England. A lot of young men, a lot of babies were named Winston in that era. And it's amazing now, as the era changes, the name changes. Now you're hearing kids named LeBron and Kobe.
Yes.
And before that, it used to be Julius, Dr. J, so it changes with the times. But
that's right.
For kids born in the 50s, yes, Winston is a common name, and Ricketts is a very common name throughout the Caribbean.
Very popular. Very popular.
So how may our audience contact you? What is your Facebook page, email, phone number?
Well, our phone number it's 973-674-1070, and we can be called for an appointment through that number. Our website is wjscottmd.com, and my email address, scottmd160@aol.com. So that is the office.
Mhm.
And at some point, I guess we'll talk about our nonprofit as well too.
Absolutely, absolutely, absolutely. So that's a nice segue. See, Dr. Scott was setting it up for you. You could talk to his better half about the nonprofit.
Okay, so tell us all about it.
President of Caribbean Medical Mission.
So you
speak
could go
about
that
Caribbean
way.
Medical Mission.
We could go down that
I'm sure
road.
we'll have time to do that.
Yeah, absolutely, absolutely
Okay.
will.
So what would you like to share about the nonprofit?
Well, again, our organization is called the Caribbean Medical Mission,
Mm-hmm.
and we've been in practice since 1996. Well, 20 years we've been going back to the Caribbean and delivering humanitarian health care to the needy, not only in the Caribbean, but also right here in New Jersey. Each year we have health fairs, and we treat the needy right here in East Orange. But for the last 20 years, we started out in Jamaica. We were, in fact, it's unique in the sense that one of the former prime minister of Jamaica happened to be visiting in New Jersey, and we had dinner with her, and she said, "Well, you guys have been in practice and seem to be doing well. I don't think you guys would want to come back to my very poor community in Jamaica and deliver some health care." And we took it as a challenge and decided that, you know what, we're going to take her up on that. And we got a group together, and we made our first trip to Jamaica. And when we saw what the need was, we decided, listen, this should be a yearly visit. And as the organization grew, we decided, why not take our services to the other Caribbean islands? So again, we talked about our good buddy, Dr. Berman Saunders, who said, listen, Guyana has just as big a need. So let's start going to Guyana. So we started going to Guyana. Then we have other friends that, you know what, people are just as poor in Haiti, in Dominica, in St. Vincent. And since then, we've been going to all of these islands and delivering health care. But then we realized people are poor in East Orange too. There are people right in New Jersey who are suffering. So each year we also put on a health fair, and we treat the homeless and provide services. If not, we give them directions as to where to go to get proper social services. Now, we also have adopted clinics in the Caribbean. So we may not be able to go to a particular country each year, but we can adopt a very small clinic and say, you know what, we're going to leave our footprint here. So often these clinics will run out of diabetic medications, hypertensive medications. Sorry, we just don't have any anymore to dispense. Well, we don't want that to happen. So we're going to provide that service. When they run short, they can get in touch with us. And what we've done is we've opened up an account with a pharmaceutical company there. They run short. We pay for it, have it delivered to that clinic.
Excellent.
We talked about telemedicine before. In our own unique way, don't care how poor a community is, everybody has a cell phone.
That's right.
Absolutely.
A smartphone.
That's
Absolutely.
right.
So as an ophthalmologist, what we provide is if a child needs a pair of glasses and simply cannot afford it, we tell the mom, well, take a picture of the prescription. If you don't mind, take a picture of the child's face so we can get dimensions of his glasses. Send it to me, and in a very short time, we'll send him a pair of glasses.
Awesome. Awesome.
Sometimes they can simply take a picture. Doc, what is this on my eye? What is this? Okay. There's certain areas, there's no ophthalmologist. We just came back from Portland in Jamaica. There's no ophthalmologist in that entire parish. Well, take a picture, send it to us. They did an EKG, they don't have a cardiologist to read it, send it to us. We can look at it, we'll give you some advice. So in a small way, telemedicine,
It's happening.
it's happening.
And it's because that these smartphones have cameras on them.
Absolutely.
And, platforms like Facebook allow you to stream right over that platform. But you're doing a mighty work, Doc. Let me ask you a question. I know you're native-born Jamaican. Are you also Jamaican?
Yes.
All right. So we have 2 yard. and loving your a nation in a way that needs to be. I was just talking to the doctor that's created this Dokita 247, it's telemedicine. And he was mentioning another Jamaican physician who was saying that there are some villages that, the roads are not passable. So telemedicine in those cases is something that's going to be a very useful tool for them to have. I don't know, when you guys go down and you talk to your friends in government, I suppose you were talking about PM Miller as the person that you took the challenge from at that time. But when you talk to your friends in government, I know when I talk to mine back home, you ask them, can you get the roads right?
Right. Right.
There's some things that if you don't have an infrastructure, you can't get things done.
Well, I'll also tell you something on that. We just came again from a small town in Jamaica called Manchineal. And the clinic is actually, I don't know why they designed it this way, but the clinic is up on a hill. The people don't live there, but it's on a hill.
Boy.
The roads getting there, you talk about potholes, these were craters. And what we were told is that the local doctors don't even want to go there because they're not well paid.
Right.
And their cars get damaged going up there. It's very difficult for them, and I can understand when I went up there and saw it myself. But roads is a problem. It not only would help people, but can save lives because sometimes just trying to get to a hospital at night and have to navigate potholes slows you down. Someone with an asthma attack or someone bleeding, a life can be lost simply because it's too slow getting there from bad roads.
That's right. And this is why in Africa, one of the things Dr. Afanja was telling me is that in Africa, many African governments are now letting Chinese have concessions over their minerals, bauxite, timber, diamonds, oil, in return, not for money, but to build infrastructure.
Right.
So they're saying, okay, let's do a dollar for dollar swap here, where you get to extract certain minerals that we have, but in return, we want you to build highways and build railways and help us to deal with the seaports so that they can, so ships can easily come in and bring goods to and from it. I think it's intelligent.
That's a wonderful barter.
Yeah, all over the Caribbean, and you see it everywhere you go, all over Africa. It's a good way of spreading their influence also. And, they may not ask immediately for a return on their money, on their help, but when that crucial vote comes in at the UN that's needed, and they'll just remind you about that little road, their influences will be...
It makes you think real hard. Even to the extent that the new African Union headquarters in Addis in Ethiopia was, $2.5 billion building the Chinese built for, where the old one stood. So they're definitely spreading their influence. But so much for the Chinese. I'm just blown away by what I'm hearing you say the medical mission has done for the last 20 years. And the first African trip sounds like it's coming up next year.
Yes, we're going to Ghana for the first time. We're actually going to be joining another group who has been going to Ghana for quite some time. So in January, we're looking forward to this.
Does the mission ever take volunteers who are not physicians?
Yes. No, absolutely. Absolutely.
How does that work?
Absolutely.
I know she's perked up.
Well, first of all, we want you to be a member. We want you to join the organization.
All right.
Okay. My daughter's studying to be a doctor.
Excellent.
She needs to come shadow you two.
And I must mention that we always take 2 medical students with us. and they're usually young medical students after they finish their first year. It's a nice way for them to see a different side of medicine.
That's right. That's right. That's right.
An introduction to giving back to your community,
Yes.
an introduction to
Yes.
charity, an introduction
Yes.
to a different type of patient,
Mhm.
and it usually lays a long impact on these students.
Mhm.
It's a different, more sterile type of medicine that they see in the United States compared to what they'll see
Mhm.
in the Caribbean.
Now, when is that again? When are you going?
To Ghana, it's January 12th to January 21st,
Of 2018.
2018. We're always looking for volunteers, people in media. We always need someone to document our work. So we need people who do videography.
Mhm.
We're usually working so hard, we don't take enough working pictures.
Of course.
So at the end,
We could change
did
that.
anybody-
We
yes.
can deal with
We can
it.
help you
So-
with that. We can help you with that.
Yeah.
Can you lift for every box? Can you lift a box?
Everyone
Everyone can help in some way or the other.
That's right.
You know,
Yes.
it's simple.
support staff.
That's right.
We have one gentleman who is so important in our mission, and what he does, he brings water to us.
Wow.
When it's 90 degrees and you're
Water.
sweating,
Wow.
and that
That's
nice
priceless.
cold priceless. So his job is, we're so happy to see him when he comes. So, you know, he's not a doctor,
He lives in Washington, and he comes.
Comes just to make sure you have.
and
Wow.
he's in software,
software.
but he plays a unique role.
It's an
He's happy to do it.
It's an incredible,
Wow.
it's an incredible ministry. You know, people talk about ministry in the spiritual context. What you're doing is ministry, as far as I'm concerned.
Absolutely.
You know, the work that the medical mission is doing dovetails right along with what we find in the scripture, because what we're doing is healing people. What we're doing is extending a loving hand to people, where I'm sure in many cases the surprise faces when you all show up in those remote villages, and doctors show up who have respect for you, unconditional love, there to treat you. I'm sure there's people that, wow.
When you put a pair of glasses on their face, on a child's face or an older person's face, and she could actually read. Now she can read a Bible.
Wow.
That is priceless.
But how many
Life-changing.
times, Sonia, do in some of these remote villages do the doctors come to them? I'm sure it's very rare. Going up the hill.
And the crater that you have to go.
Yeah.
The doctors are not going.
That's right.
You know, and people can, and even if they come or they go to a private doctor, they can't afford the cost of these things, medications, the glaucoma, medicine. You know,
Yeah,
Wow.
it's unique in that when we go into a community, we also try not to disrupt the economy of the doctors that were there. He has his own business. But we are not, we're seeing patients that cannot afford to see them.
Mm-hmm.
We're going remote areas,
Mhm.
usually far away from where these doctors,
Mm-hmm.
because too often we see patients who were properly diagnosed, started on the proper medication, and then they just stop because they simply can't afford it. And as an ophthalmologist, that really irks me to see it. Patients who just ran out of medication, you see them going blind.
Oh.
So we try to carry enough medications that when we find someone, we can give them at least 1 year, sometimes 2 year supply of medications. And again, it doesn't solve the problem, but if for 1 year you don't have to worry about
Yeah.
eye medications,
Yeah.
that's the type of impact we're trying to
Yeah,
have
but
there.
but even that step is major as compared to what kind of life impact it's going to have on that person as opposed to where they were. Early morning TV has some interesting infomercials sometimes. I'm an early riser. I'm up at about 4:30 every morning, so sometimes I take a look at what's on. And I see that organization called Smile, I think, where they get rid of the cleft that some kids that may be born with. And, so I did a little bit of research on that organization. That organization is doing a mighty work, but it's pulling in hundreds of millions of dollars of support. And I raised that to say, how does the medical mission fund itself? Is it entirely out of the pockets of the doctors involved, or is there some outreach to let the greater community know how they can help expand the mission?
Well, each person will go on the mission, pay their own way. Pay your own way, give up your vacation, you close your office for that time if you have to, and you go. So that loss is, we don't even count that loss. That's a tremendous loss.
Mm-hmm.
But the medications, we get support from the public. We have two major fundraisers each year. One in the summer, in fact, one is coming up shortly, and it's going to be July 15th.
And you got to wear white.
Okay,
It's an
I'll be ready.
all white boat ride.
Cruise.
It's a beautiful event.
Okay.
It's an all-inclusive open bar buffet. We sail from Liberty State Park in Jersey City. We board at around 6 o'clock, and we leave at 7 and come back around 11:30. And that's one of our major fundraisers. And that's a very nice way of helping your fellow man, your fellow
Yes, it
human
is.
being.
That's
And at the same
wonderful.
time, having a wonderful summer. It's a nice group of doctors, nurses, professionals who just have a good time. And our next event is a black tie event that we have in December. This year it will be December 2nd. It's kept at the Bethwood Manor in Totowa, 7 o'clock, 7 p.m. And it's also a very nice event. And we usually honor one or two, either someone who have been very helpful to us. We always try to honor at least one elderly senior doctor. One of the guys who from the 60s or from the 70s was on the firing line, taking all the hits for us, and we may have forgotten them, but we try to bring them back. Sometimes they say people forgot about us. So no, we bring one of them back each year and publicly tell them thanks for all the work they've done, because we're standing on their shoulders. So that's a unique thing that we do every year at our dinner dance in December. And those are our two ways that we raise funds. We try to get donations from whoever will be willing to give us. But those are the two major fundraisers, the public and ourselves. We always tell our board members, if we're going to go out and solicit money from the public, let's start with us first. So let us put our monies on the table first, then we go out and ask the public. But that's the way we fund ourselves.
I think that you're doing an awesome work, and I think that I'd like to see our audience find a way. If the audience goes to your website, can they make donations there?
Absolutely. If you on the internet, CaribbeanMedicalMissionNJ.org. You can make a donation by PayPal, or again, my office, or my email address. My email address again is scottmd160@aol.com, but CaribbeanMedicalMissionNJ.org. And the website will open up as to how you can contribute. But that's the way we fund ourselves.
You heard it here.
I'm looking forward to those two events. I'll be there.
Okay.
Beautiful events.
Ministry.
I'm looking forward to
A
it.
lot of giving back.
Ministry and a good old-fashioned good time. In the time we have left, I know I have one question that I'm dying to ask you. What, if any, impact did the Affordable Care Act have on local medicine, and what, if any, impact do you anticipate from what you've heard or read of what the Republicans are proposing? Because it seems that there's a concern that many people will lose what they got under the Affordable Care Act, better known as Obamacare, and what is being proposed. What do you think about what you're hearing, Doc? Is it something that urban communities should be concerned about?
Oh, absolutely. The Affordable Care Act, Obamacare, reduced the amount of uninsured throughout the country by almost 30 million. and expanded Medicaid, and people who were never able to get on simple Medicaid were able to get onto this open up healthcare to these people. What we're hearing from the Republicans is really nothing. We really haven't heard anything. It's all done in secrecy. But from the little dribbles that comes out, it seems as if a lot of those people are going to lose their insurance. So the very people who voted for Mr. Trump will actually be losing their insurance.
Absolutely. I've seen them crying on TV.
Yes, yes. So I don't think we can say anything as yet, but the feeling is not good. But it's just kept in secrecy. How much input we would have? Can we make any amendments to it? I don't know. It's going to be a very limited amount of time to act on it. But from what I'm hearing, they're going to reduce. They're saying is they want to reduce the burden on the states. Which when Obamacare expanded Medicaid, in some states they thought eventually they will be paying too much money out of their own pocket, out of their own treasury. But it opened up and put a lot of people on Medicaid. But it seems as if they're going to lose a lot of those people. So a lot of people will be uninsured.
This is so interesting because the states in which the Medicaid was expanded the most dramatically make up the core of his voter base support. Alabama, Mississippi, Kentucky are states that voted overwhelmingly for him. I wonder what their senators and congressmen are going to tell them when they lose their health care, because these places went for him. And I guess they didn't understand they were voting against their own economic interests. Right. But now that the policy is about to roll out, they're going to find out that he wasn't for them. Well, maybe cooler heads will prevail. But it seems to me that what the Caribbean Medical Mission is already doing, without concern about public policy, is taking it in your own hands as a group to deliver at your own expense care that people would not otherwise get. And I think that's awesome. Maybe you should have come here with a white collar instead of an open neck shirt, and we call you Reverend Winston.
Yeah, because you're definitely doing God's work.
Oh, he's definitely
doing God's work.
Definitely doing God's work. So I want to ask Mrs. Scott, have you gone all 20 years on all the trips, or there's some you haven't?
There's some I haven't been, because when my kids were younger, somebody had to stay home with them to school, right? But since, I would say, the past 10 years, I have been going with them. And they, in collaboration with Dorson Community Foundation, the doctors in this group also work along with Dorson Community Foundation, because
so the care providers go as well.
They help, to fund, because they help to fund Dorson somewhat or in some way, and we work together even with their health fairs. So it's like a team effort. We do Feed the Homeless; they're part of that team. We do Toys for Tots, which they must not help to contribute the fund to buy the toys to these kids. And who could tell in this case no?
Hey.
That's right. That's right.
Sometimes I help. I didn't even know I helped. But she's also a very important part of when we on our mission. We have what we call an eye team. We see a lot of eye patients, and we have a very structured way of seeing them to make a quick turnaround. And she's a very integral part of that team. So we help each other.
As I said earlier, she's what we call in Guyana an all-rounder. These are people who just know how to make an impact, know how to make a contribution in many ways. And as you said rightly, I'm sure from time to time you get to lend a hand trying to keep up with her. So, but you're doing a mighty work in your own regard, and we thank you for that. I just don't want to just not take it as seriously in terms of the support that the medical mission and certainly Dawson needs as well. I think if more people were aware, more people would support, more people would help, quite frankly, because I can just, from an intellectual and a spiritual perspective, see no reason a person would have for not wanting to expand this. I mean, what argument would you have? Are they taking money? No, they're doing it out of their pocket. Where are they going? The Bible says, inasmuch as you've done it to the least of these, my brethren, you've done it unto me. So where are you guys going? To the least of these? Up hills, under hills, wherever, carrying water. I mean, the public needs to become more aware, and Lisa and I will work to make that happen. Her passion is travel, so I'm sure she'll work to be one of your volunteers. She just came back from Greece, has been to China, etc.
Yeah,
So,
and France. We had a good time.
Excellent.
so you're talking about Ghana. You know that she wanted specific dates.
Yeah.
So her questions would be, how can I earn that responsibility, that opportunity, rather? We say every single night that our favorite scripture is the first Genesis chapter 26 through 28 that says you're made in the image and likeness of God, and given His authority to rule. And so I can just go on and on about that, but what you're doing is showing God's face to people who don't see it sometimes, and I want to thank you for that. You're indeed kingdom builders, doing it as a couple, and you guys are setting a mighty fabulous pace. So keep on doing what you're doing. The practice of Winston Scott, the Caribbean Medical Mission, and certainly the Dawson Foundation. One final question I have of you. The two of you, your last name is Scott. Why Dawson? What is the significance of that
She'll
term?
tell you.
Well, when I actually started at Dawson,
Mhm.
I only had my son. My son name is Dorian. So it's a combination of
Look at that audience. You get it
Dorian
tonight.
and Sonia combined.
Is
that
Dawson.
Oh.
Unique name,
Wonderful, wonderful, wonderful. So that answers that question. That is awesome. Remember, Matthew's broadcast audience, and this is particularly fitting tonight. Maya Angelou said, people will forget what you said. They may even forget what you did, but they will never forget how you made them feel. I couldn't think of two more appropriate people that I could say, Winston Scott, Sonia Scott, thank you for making people feel good.
Thank you so
right.
much for having us.
That's right.
And you keep up the good work for what you're doing. We appreciate it.
Thank you.
This is Stan Matthews, along with Lisa Thompson here, my co-host this evening, and we just want to say there are two types of people in the world. There are dreamers, like Dr. Scott and Sonia, and there are dream killers. Embrace the first, run like heck from the second. This is Stan Matthews and Lisa Thompson saying good night and God bless.
Good night.
Thank you.
Fabulous, fabulous, fabulous.